And of course, it's that time of the year again where we get to ask you a critical question as to why or when you decide to visit a doctor. Oh, well, it's good to be back on your screen like we never left. This is Gyna Plus right here on Afia TV. And of course, my name is Doris Mayim-Shishe, saying a very beautiful, warm welcome to you. It's more like the first official outing of the year. We've always been there low-key, but we are here fully. And of course, you see my regular Dr. Brenda very soon. See how beautiful she's looking. Good evening again, and welcome to Gyna Plus. This is where we talk about issues, health issues actually, that affect women and girls in the society. And of course, this program comes up every Wednesday at 6 p.m. and you can catch up with a repeat broadcast on Saturday at 8 p.m. And Afia TV is on DSTV 254, on GoTV, catch us on channel 17. And yes, we're on Free TV, channel 748. So you can also go to YouTube, visit our YouTube channel, Afia Lifestyle and Culture. You can catch up on all the recordings that we've done so far. And today we are doing something that's often overlooked, very important to our health, particularly to women. Everyone, but women in this case. And after the break, you'll meet beautiful Dr. Brenda, and then we delve into action. Please stay tuned. Welcome back. It's good to have you. Stay tuned. This is Gyna Plus right on Afia Television. And this is where we talk about health issues that affect women and girls in the society. And like I said a while ago, my name is Doris Mayim-Shishe. This is the face you've been seeing for the last 3 years now on this show. And it's so good to be starting the year with you again. And I mean, this, if you've been seeing me, you've been seeing Dr. Brenda as well. Dr. Brenda, I'm not going to say Happy New Year because the year is already old. And we've said this over and over again.
Happy New Year.
Well, let's not make it look like it's happy. You and I have talked over many times before this show. Happy New Year officially.
Thank you, Doris.
Good to have you.
Good to be here.
Good to have you.
Good to...
And yes, for the first time, we just didn't have that memo. We
didn't get the memo. Is this the year of not getting the memo?
No. I choose not to be, in that line. How are you doing?
I'm doing good.
Good to have you. You look really fabulous.
Oh, thank you. It's a good year.
This is
already.
how a doctor should, Doctors, anyways, always looking fresh. So, Dr. Brenda, you see, today, like we did sometime last year, we started the year with reminding women why it's important to do annual checkups. Yeah. I remember last year you talked about these things, but this year we went a step further a bit. I spoke with some women as to whether or not they usually avail themselves of, checking their body. It could be a gynecological checkup, it could be an overall body checkup, but you will be amazed to hear some as to why they don't do it. Just take a moment and watch these ladies. We'll be back, and then Dr. Brenda will react more on this. Please stay tuned.
Well, I don't casually stroll into the hospital for checkups. I wait till I'm very sick. Like I'm literally very sick, or when I don't understand what's going on in my body. That's when I go to the hospital. I don't like the hospital. The queue. But maybe I will change.
I'm Brenda Akanisi, Deputy Commander of Narcotics, NDLEA State Command, in charge of media and advocacy. As a woman, I personally, every 3 months, personally, that has been a system I've kept. I personally go to my doctor. I have an HIS hospital where I use. So I normally go there, do my routine checkup, not waiting when I'm down.
I'll wait till when I'm sick before I can go to the hospital to run a test. Then secondly, the financial cost, financial implication. I might not really have enough money to go and be running tests and all that. So I prefer to fall sick before going to the hospital to run a complete body test. Thank you.
My name is Doris Mayim-Shishe. As a woman, I occasionally go to the hospital for checkup, random checkup of all the parts of my body. I don't necessarily wait until I get sick. I do it regularly so that to prevent any ailments or illness that will come, knowingly. So they said that prevention is better than cure. I normally go for random checkup.
All right, welcome back. I mean, you're still watching Gyna Plus right here on Afia TV. And before now, I wouldn't even lie. I probably would say, okay, this is me, or I would be in any of these categories. But here we see have Dr. Brenda seated pretty, and I forgot to add earlier on. Dr. Brenda, there's no way I wouldn't read this. Dr. Brenda Akanisi is a family physician and also a lifestyle medicine physician. And she's also the Young Doctors Forum coordinator, M1. Dr. Brenda, we're supposed to do, because it's a new, there's a new portfolio to,
And was that
yes,
strong?
very strong. Very. That's why I said, why would I ever forget something like? Congratulations on this.
Thank you, Doris.
And yes,
Thank you.
we watched some of those clips.
Yes.
And before now, honestly, I'll be in that category. Why would I have to say, doctor, when I'm not sick? Like, where's all of that money? But why is it? I know you're going to react to these women. Why you're reacting to some of these? I mean, 2% says they get to do it, and if you notice that elderly women, that the ones who said they get to do it, that one said 3 times in a month. The other says she does it once in a while. The other lady said, "Where is the money?"
But it tells you from the age, demographic can already tell you that when you're older and there's some issues that happen, you just have the common sense to know that you have to go regularly for checkup. And the thing about it is that when people are much younger, nothing is wrong with them, nothing's happened. They feel, okay, I'm good. I don't need to go see the doctor. I don't need to go for checkup. Most of them just walk into a shop, pick up medicine. They won't treat themselves and they feel they are good.
We already mastered the way our body works, so we should know where something is going wrong. But I mean, professionally, why is this important?
Okay, so we won't even know, before we streamline it to gynecological, what is annual checkup, right? So for annual, we know it's done yearly. So it's a yearly assessment of how your body is working. Is it working optimally? So the whole essence is to go in, let's check and see what's happening and know at what point in time to intervene. And this checkup, a lot of people just feel is only investigation, but it's not. So you need a healthcare provider to ensure that you have a proper annual health check. So this involves when you go into the health provider's space, they need to take a detailed history, because from the history, we get to know about your family members. Is there anybody in your family with hypertension, diabetes, and all that? You can also give us a clue to be like, add some additional tests on a normal day we wouldn't, right? So after the whole interaction, and people don't even understand, the more you interact with, your healthcare provider, the more you would go for an annual checkup, right? And now, after that is done, the next step is to now do a proper and detailed physical examination. So the whole general system is checked, and we see if there's anything that seems abnormal, then we investigate further. So the next stage we now enter is we now go and start taking your blood, tell you to go and do a scan and all that, to now look internally and see, okay, what is really happening. And when we have this test, people are used to doing kidney function, liver function, all of that. And that gives us a guide, your full blood count. So people don't even know something as simple as doing your full blood count test can give us a clue to be like, okay, if your blood is low, it's now going to show us, could this thing be deficiency of iron? Where's the problem coming from? And little things like that can be investigated. A lot of people say, I feel tired and fatigued and all that. That symptom can come sometimes from a low, blood level. But people just feel, maybe I'm stressed, but by the time you do an annual checkup, I will tell you something. There's a client who, she's okay on the normal, but she went for her annual check. They realized her HB was very low. That's her blood level was really low. They had to investigate to find out, why is your blood that low? They did all the whole test and nothing was found. So all she just has to be is on supplements now and all that. Once in a while she comes for her regular check. So in that kind of case, it won't just be an annual check. She has to do more than once a year. So there's some people I know personally who will do twice a year, who will do more often, maybe every 3 months. So it depends on also, maybe there's an underlying condition that the physician needs to follow up with.
Let me quickly cut you there, because a bit of a digression, but still in line, sort of. In a case where her blood group was that low, blood level rather was that low, what is the consequence, like a health consequence, in a case where it had gone untreated, for instance? What is the outcome going to be like?
So what's the function of the blood basically is to carry all the nutrients. Is to help oxygenated blood helps to provide nourishment for all your organs. So imagine if it's not working adequately. Do you get? That's why I just said earlier, people feel fatigue. The next thing you say, this person. Do you understand what I mean? So
it's very important.
It's very important to check this thing and to know where because some people can even be having some internal bleeding they're not even aware of. And because of that low HB, by the time you start doing investigation, they now find out. And also the beautiful thing about it is when you go for your annual check, they also tell you the test, because we also have some screening tests that is done based on your age. Now, because we're focused on women today, when you're even doing the physical examination with your doctor, he'll get to palpate your breast. So if there's any lump, he can pick it out on time and say, okay, no, go for a scan. If you're above a certain age, they recommend a mammogram. If you're less than 40, they'll tell you to do an ultrasound. Then you can pick up, because a lot of people is asymptomatic. It's maybe when it gets a bit too far. And the beautiful thing about it is that when you detect this thing early, things can be done better about it. So to me, it's not even a compromising thing to say, oh, I would check. It should be a necessity. It should be included. You know, when we've set goals for the year, please include it. And another thing is that a lot of people even forget their dental appointments. That is important as well.
I think you catch me as that one.
That is important as well.
It's always a dental like, whoa.
Most people go to to their dentist when it's time to pull out. They just don't go to see.
When
Okay,
they
what's
say
this?
ache, yes.
Do you understand? Even you're meant to go see your eye doctor as well to make sure if there's a family history of some certain diseases. You're meant to go check your eye pressure and see if it's okay, to know if there's any nerve damage. And the beautiful thing about it is that when the ophthalmologist is actually looking into your eyes, he can even pick some underlying issues and be like, okay, this is linked to this, and help you out on time. So it's something that we should take seriously. It shouldn't just be something that we keep at the back burner. We should bring it to the front burner and cook it well.
Well, as important as this is, one of the ladies, of course, talked about the fact that in this economy, the financial constraint, how do you even pull up with all of these that you've mentioned?
Yeah.
So what are these ones that are more, if you want to categorize them, for
Okay.
instance, like now let's bring it down, maybe before we even delve, if we have enough time, to the main gynecological issues. What are the core ones that you know that, okay, I need to check these boxes because this is more like top of the list?
Okay. Now like I said, it will be based on your age, also a family history. So once you have family history of maybe, I'm streamlining now to the female. Now, even if you're sexually active, there's some tests you will do more compared to somebody who's not sexually active. So you need to get your pap smear done every year. If it's abnormal, then, something can be done immediately to help prevent further, complications, right? Now, if you have a family history of breast or cervical cancer, you should check more often than somebody with no family history. So you can see how these annual checkups can help bring some things that you're not even in the know. And the thing about it is that sometimes when you're even interacting with the healthcare provider and they say some symptoms, and you'd be like, oh, I know one of my auntie who had, you hadn't registered prior to now, but the more you interact with the healthcare provider, you'll be like, oh, I know, my auntie died of this, or my uncle had this. And they can now say, okay, you know what, let's run some investigations and see if you're in the category that will predispose you to getting some.
Okay, so I like the fact that I like the fact that you mentioned earlier on for pap smear, of course, and then for mammogram 40 below.
No, 40 above for mammogram.
40 mammogram. Then you talked about ultrasound. Yes, and then but for issues like STIs or other issues.
So you go for your HIV,
yes, say for
your
someone who's
hepatitis and all
not
that.
sexually active, for instance. Is it still important? So I might not be sexually active, for instance, and I want to do this test.
It's important because then again, there's even some jobs you apply for. They will still tell you they need all those tests. It has to be done, presented to them to make sure everything is okay. So even if people just feel, okay, because I'm sexually active, no. When you go for an annual check, there's some routine tests that will be done. And also some of the screening like for HIV, hepatitis will be done as well. So it's regardless of whether you're active or not, do the routine test.
Okay, for young ladies, what age would you recommend?
Now, I would say, if average you say 21.
Okay.
21, we believe that's when,
you've grown.
But we also know that there's some underlying challenges. Let's say somebody starts period on time. About maybe she starts her period, maybe 7, 8. That should give you, that is not normal. So most likely you have to investigate that person. And that person has to probably call you for follow-up. So she has to do more annual check than. So you can see that's not, you can't just fix a number and stamp on that number. Because let's say another person has fibroid that was detected earlier than 21. You will still need to follow up. If the person has any form of dysmenorrhea, painful menstruation, you have to investigate. And you also need to follow up in that case. So in as much as you can say, yes, at 21, but then again, if there's any other condition, you also have to realize you have to streamline the annual check to your client, not just working with a general number.
You see, I'm also learning a lot from this. The dental thing is something I will factor in. All right, you see Dr. Brenda here in the studio talking about why it's important for everyone, but in this case, because it's, the program for women, why it's important to avail yourself of annual checkups. So I know that times where it feels like, oh, this whole mental thing of fear. What if they discover something? What if they find out that? What if? Now, after this break, Dr. Brenda will tell us how to prepare yourself mentally for all of this checkup. Please stay tuned. Gyna Plus returns in a moment. Welcome back. You're still watching Gyna Plus right on After Television, and this is where we talk about issues that affect health issues specifically that affect women and girls in the society. My name is Doris Mayim-Shishe, and today we've been talking about why it's important for women, for everyone, but again, specifically for women, to always avail themselves of annual checkups, gynecological checkups. And I see how beautiful Dr. Brenda Akanisi right in the studio. Dr. Brenda, you talked about, you wanted to address the issue of cost earlier.
Yeah.
Before we talk about the mental preparation, talk to us about that cost.
In terms of cost, one, I would say get an insurance. And when you get an insurance, also find out, because some insurance plans do not cover all the investigations for your annual check. So they will cover some, they'll tell you have to pay out of pocket for some. So a good insurance plan most likely will cover the majority of the investigations we need to run. So get good insurance. And I also think, Doris, maybe in the cost of, we've never talked about health insurance, it's something that is key because it's a lifesaver. So I think it's something that people should key into. That being said, a lot of NGOs organize free health check. Like I know people do the pap smear, the mammogram and all that. Like I know medical women, they do it yearly. So I know some people who come yearly when we do it. So at least they know that they've done their screening for cervical and breast cancer at least once a year. And these are professionals who are doing it. So when you hear such foundations who are offering this thing by trained, not just but trained personnel, I think avail yourself because this opportunity may come, once a year, which is annually, and you get to benefit from such things. So in that way, you've saved your money as well. So these are the few tips I can give people out there.
Okay. So, but of course, you said the discussion on health insurance would be another one on its own, because I was going to ask a follow-up question like that.
It should be a big topic because it's quite, a lot of people just feel, because until I have a job, until I have this, they're different plans.
Okay.
Do you understand? So yes, of course, we have the government one, we have the private, and also I think it's something that we need to talk about holistic, so that people are informed about ensuring, getting a health insurance plan, because it's paying out of pocket sometimes hurts you a lot. Do you get? So
all right. So back to the issue of people not being ready mentally to go for certain checkups. I know of someone who, once he falls sick, a man actually, and you tell him he needs to see a doctor and they want to run some tests, you say no. He doesn't want to know the outcome. There's this fear that exists now. I don't know where that is coming from, but I know certain women who are like that too. For the ladies who were privileged to, or who of course spoke to us, because it wasn't a privilege, sort of. They really spoke to us, and they talked about the fact that one of the ladies said, "Until I fall critically ill, I would not see a doctor." So for her, she has to be shaking to see a doctor. So it could be some sort of phobia, maybe, because she didn't say finance was the issue. So how do we prepare that?
It's not just for, we call it the white coat syndrome as well, white coat syndrome. So even as children, once they see the white coat, they start to cry. Do you understand? So that's why it's advisable to avail yourself to a hospital setting, even when you're not sick. So you don't always associate the hospital with illness. It's a mental thing. So if you are under insurance and you happen to just walk in, you're not paying out of pocket. So guess what? It's easy for you to walk in because you want to use your insurance money, isn't it? So when you walk there and you familiarize yourself with the doctor and you feel calm and relaxed, there's no way when he tells you to do your annual check, you will not come. Sometimes you even come. I have patients who come just to chat because you've created that rapport with them. So they don't see the hospital as a very caged, environment. So in terms of you preparing yourself when you're going for this test, you can also read around some things you would like to do because, the internet is available. People are more knowledgeable now. So also try to read more. Even if your doctor recommends a test, go read more about it. Because there's sometimes they'll tell you, okay, we're going to run this test, come a specific day. When you come, ask questions. Some of those questions can actually help, dispense the whole anxiety and anger. And let me not lie to you, everything new, like we do, let's say you're going for an exam, you will hyperventilate, isn't it? So you have to learn to take some breathing, exercise techniques, like breathe in and out, calm yourself and tell yourself, it's going to be fine. Because most of the time, These results come out and they are good.
Do you know up until now, for someone who's going for an HIV test, they still panic. So you see, it's
What are you panicking? What are you
no,
belong
but
to? What are you
because of the
belong to?
stories, I'm saying that times when you even read up stuff and you're even creating more fear. So you go to the internet and see someone who used the clipper and there's a blood stain and there's
Yeah, but
small
you know
thing,
the
and then you start
but you know
panicking
the
because I
beauty.
did it. And what if?
But you know the thing about it, that's why it's good to detect it on time, so that down the line you will not be living in regrets.
So
What
you
if?
have to check.
So you have to always also have a positive mindset. Okay, I'm going to run this test. Because that, let me not lie to you, some healthcare providers try to put all the cards on the table and let you know, okay, you do this, see the pathway. I do this test. Is either positive or negative. If it's positive, that are the option. If it's negative, okay, no problem. Go back, see no more,
Stay
and
safe.
come, stay safe, and come back again. Do you get? So that's what I'm saying. You have to have that interaction and realize that, see, this is for my own good. The way you take your car, for you to change the oil and all of that, you need to go and make sure your body is okay. Because at the end of the day, most of the time, you come out and all your paperwork are good. And you carry on till you have another annual check and you come and, everything is fine again, by God's grace. So I just think people should alleviate the fear, because a lot of young people would rather not know. Like in the interviews that you had said, that we saw, the elderly ones were, because they've gotten to a point of what's the worst that could happen. So they have that mindset like, what's the worst that could happen? But the young ones are
If
like,
I perish, I perish, but I have to know. You know
but the
that.
young ones are like, I still enjoy life. But now also, besides the mental preparation, also come for your tests. Be physically prepared. Please wear clothes that are easy to remove. Be comfortable. Because sometimes the waiting hours and facility, and that's another thing. So people just don't like the long waiting hours and all that. So if you're comfortable.
And she talked about the queue. I think one of the ladies talked about the queues, and that too,
So sometimes wear a free-flowing gown so that when it's time for, the physician to examine, it's easy. Instead of you struggling with belt, you're wearing jeans that you struggle to pull up. So all those kind of things just makes it messy. Another key thing for women, avoid going for your annual check when you're menstruating. Because if they want to do some, examination, you have to say, oh, sorry, you cannot. So that will even make you uncomfortable because you're in your period. So avoid going during your period. Wear comfortable clothes when you're going there, and just have patience, because the waiting time may be longer.
Maybe
than
go earlier or make it on time. Okay, as we're wrapping up now, there's actually a segment or an episode where we'll talk about adolescent and how mothers can come in. It's a very interesting episode, really, because here we're talking about women. But before we go, why I'm even bringing up this is because of the question I have for you.
Okay.
There have been lots of misconceptions as to you've addressed some of them.
Yes.
Someone who is sexually active, why do I need to see a doctor? Someone who's not pregnant, why do I need to see a gynecologist? So different questions around that. You already told us why all of that is important. Yes. Now, for younger women who are watching this, for instance, and you've talked about the menstrual thing, fibroid, and all of that. What is a long-term benefit as to why I might be 15 today and I want to see a gynecologist?
Knowledge is power. It's that simple. Knowledge is power. There's no way if you've watched this episode, you're not taking something out, even if you're 15-year-old. So even if tomorrow somebody wants to come and lie to you, do this with me, do some, have, sexual intercourse with me and all that, you're already prepared with the knowledge. So that's why it's good to go for your annual check, because you get to ask your physicians questions. Oh, what if my boyfriend wants to sleep with me? What do I tell him? Oh, what if we slept together and had unprotected sex? What do we do? So those are the information you get from an authorized source, not from your friends that will give you wrong advice. Okay, what if there's early teenage pregnancy? What can I do? So this is the advantage.
Maybe rape incident too. Sexual abuse issues too.
So now even in terms of, I noticed, there's a lump in my breast. What can I do? I noticed a lump in my mom's breast. Because people don't understand the power of information. It may not even be to save the child. It may be to save her auntie. It may be to save her mom, which in turn saves the community. So I think the young ones, don't be afraid of knowledge. The same way you can spend hours scrolling on, social media, listening to things that probably will not benefit you, I would say also engage yourself in healthy content, so that when you present yourself in front of your physician, you can ask intelligent questions and they can clarify some, misconception or myths that maybe you've been taught all your life. And you can gain more knowledge to own your body. So when somebody wants to tell you something that is different, you say, no, I have the right information.
Yes.
And it creates a better, healthy environment for you.
All right, thank you so much, Dr. Brenda. I wish we could go on and on again, but this is where we will definitely say goodbye today. I mean, we'll be talking about why it's important for women, everyone, to have, their annual checkup. As you're making or setting your goals for the year, always prioritize your health because, I mean, health, of course, they say is wealth. And Dr. Brenda has been doing a wonderful job. Thank you so much. Dr.
Thank you,
Brenda
Doris.
Akanisi
Thank
is
you,
a
Doris.
family physician and a lifestyle medicine physician as well. And she's also a young doctor from Coordinator M1. And of course, this will be up on our YouTube channel maybe sometime within the week. So do well to go to Afia Lifestyle and Culture. You can watch it. Or on Wednesday, 6 p.m. If you're in your home, you can tune into DSTV 254 or Go TV 17 or on Free TV 748. That way you won't miss out on anything. My name is Doris Mayim-Shishe. Has been good doing this video. See you next week and have a lovely